Hello, good evening, friends from CCI and those who have logged in for this very interesting and unusual topic of disease X. I think we always talk of guidelines, we always talk of correct therapy, we always talk of established guidelines. This is there in the guidelines and so on and so forth. But disease X, what do we know about it in the first place? It seems to be there in the news of late in a very big way, but the whole story seems to have started as back as 2018. And to know the entire concept and the mystery of disease X, uh, we have this wonderful panel. I'll just take the names initially. We have public health expert Dr. Animesh Jain from Mangalore, Dr. Ravi Dosi from Indore, Dr. Amita Nene from Mumbai. She'll soon join us. And we have two wonderful youngsters, Dr. Keerat from Ludhiana and Dr. Tanushree Gahlot from Noida. And I request Dr. Tanushree and Keerat to give their speeches one after the other. And Tanushree is going to speak about the basic idea of disease X, and Keerat will talk about the potential microorganisms. So, with that, over to Dr. Tanushree.
A very good evening to all of you. I thank Dr. Krishna and CCI family for giving me this opportunity to talk today on a very hot and trending topic, which is disease X. What exactly it is and what is WHO stand on it. I'm Dr. Tanushree Gahlot. I'm a senior consultant pulmonologist at Apollo Hospital, Greater Noida. And today we are coming up with this topic of interest, disease X. So, what exactly is disease X? We have all been to our cinemas and saw Pathan, a recent hit movie, and Mission Impossible sequel, which covered biological warfare. And they talked about something called Rakt Beach. Rakt Beach means meant in that movie as a biological weapon, a smallpox virus which was latent since ages and has been used and modified by the countries and all to use it as a biological warfare. So you can imagine what a particular disease can turn into. A recent COVID pandemic was an example of that. And here we are discussing a disease which can be n number of times more deadlier and contagious than COVID-19, a disease called as disease X. You can see all over the media, it's trending. Jagran, Times of India, Mint, international media, national media are all covering exactly what exactly is disease X and what has to be done about it. So disease X is a placeholder name that was adopted by WHO on February 2018 on their shortlist of blueprint priority disease. It represents a hypothetical and unknown pathogen that could cause a future pandemic. So basically, according to WHO, the term represents the knowledge that a serious international epidemic could be caused by a pathogen which is currently unknown to cause any human disease. So it can be a new agent like a virus or a bacterium or fungus without any known treatment even. So the global health body WHO has included disease X in its list of priority diseases. What are these priority diseases? These are COVID-19, Crimean Congo fever virus, Ebola, Lassa, Middle East Respiratory Syndrome, Nipah, Rift Valley, Zika. I'm not going to discuss these in detail because my colleague, Dr. Keerat, is going to cover these in the subsequent sections of the discussion. So let's focus exactly on disease X. What is exactly disease X being enlisted by our body, WHO? So, by listing disease X, an undetermined disease, WHO basically acknowledges that the outbreaks don't always come from an identified source. So, based on this announcement, in 2018, the Wuhan pneumonia, which caused catastrophe all over the world of immunology, was designated to be the first disease X. Later, this pathogen was identified to be the novel coronavirus, which is denoted by 2019 NCOV. So, to address this global pandemic situation, when we had Ebola emergency in West Africa in March 2014, WHO came up with this in 2015 for its pandemic preparation. A member organizations together to create an R&D research and development blueprint for action to prevent pandemics. The idea was to generate what can be done to reduce the time lag between the identification of viral outbreaks and the approval of vaccines and treatment. The idea was to stop these outbreaks from turning into a public health emergency. As a group of global experts, R&D Blueprint Scientific Advisory Group came together, assembled by WHO, to draft a short list of less than 10 blueprint priority diseases. So basically, worldwide, a number of pathogens are available, which are very large in number, and the resources to go for this research and development being very limited. So the global health body decided that to work with scientists, develop a customizable formula of creating vaccines. Then, when an outbreak happens, they can sequence the unique genetics for the virus that is causing the disease and plug the correct sequence into the already developed platform to create a new vaccine. A UK scientist named Dame Kate Brigham is the one who recently took this term on media and the word started trending. So, what exactly she said? She said that caution is required for disease X and it can be several times more deadlier than a coronavirus. It's likely to originate from any of these existing organisms, drawing parallel with the catastrophic Spanish flu in 1919, 1999, 1918 and 19, which killed over 50 million people. So one of the initial action that needs to be taken is to allocate sufficient amount of financial resources, like essentially putting money on the table, so that the monetary cost of these inaction can be seismic. So after all, even the COVID-19, which is considered a so-called milder virus as compared to disease X, it managed to leave us a holding bill of 16 trillion US dollars in both lost output and public health expenditure. So we have to have manufacturing capacities being assessed as they are varying over the countries and region. Some vaccines format may be suitable for large scale production, while other are easier to produce in the third world. So addressing all these shortcomings of the current vaccine, a new way which are more durable and easy to transport and cheap has to be developed. The researchers must be encouraged to trial new technologies and approaches to design a vaccine leading to production of efficient and effective vaccines. So as per Bingham, the world has to prepare for a mass vaccination drive and deliver doses in record time. It can be as infectious as measles and can be as deadly as Ebola, up to 67 case fatality rate. So somewhat in the world it's replicating and sooner or later someone might be going to fall sick. And we cannot underscore the importance of scientists developing a collection of different prototype vaccines for every life-threatening virus family. So a head start vaccine has to be given to target specific features of disease X. So to chronologically date what exactly led to the development of disease X and what exactly the globally disease and its sanctity stands, as big organization as United States Agency for International Development, USAID, and the Predict program has identified whether what are the early warning pandemic system signs, identify the hotspots for animal human interaction. As far as February 19, CEPI funded 34 million US dollar to German based CureVac pharmaceutical company for an RNA prototype vaccine. In September 2019, Daily Telegraph covered a public health England launching its own investigation for a potential disease X occurring in United Kingdom. A diverse range of their public health system diseases were identified, and 12 novel diseases were recorded in the system in the last decade. October 2019, New York, the WHO Health Emergency Program ran a disease X dummy run. In March 2020, Lancet published a paper that accelerating development of the countermeasures that can occur in the next pandemic. And they labeled this disease X pathogen as pathogen X. That is in international coordination. So April 2020, the Daily Telegraph again described remdesivir as a successful drug being trialed for combating COVID-19 because Gilead Sciences was already working on those lines of future predictable disease X. So reaching to as latest as August 2023, even UK has appointed its scientists to already initiate vaccine development effort which are targeting these disease X. So research is being conducted in a very high security uh, Porton Down laboratory, which is situated in Wiltshire, and it was around 200 scientists at a time. So this disease X can be a potential entity taken care of by WHO and different countries. Huge programs are running after it. Huge money is being put into it to prevent further damages and to be combative and be ready for the next pandemic can be as deadlier at killing 50 million people at a stretch. So we have to go further with the discussion. I end my presentation here and switch over and hand over to Dr. Keerat to identify these organism potential threats that needs to be addressed. And thank again for your patient listening. Let's move on to Dr. Keerat. Thank you very much.
A very warm good evening to dear CCI family. Let me begin this session first of all by thanking Dr. Krishna sir for bringing such an amazing and out of the box topic for all of us again. Thank you, Dr. Nitin Abhyankar sir, for the kind introduction. And I'll take it further from here. Dr. Tanushree has just given us a very comprehensive briefing on disease X, and I will be talking about the potential pathogens and disease X. So WHO launched a list of priority pathogens, that is, that agents that can cause outbreaks or pandemics, to guide global investment, research and development, basically capacity building, especially in terms of vaccines, tests, and treatments. WHO adopts a viral family approach to identify prototype viruses within a family to generate R&D and fill the knowledge gaps. So in case of another threat, which could be global or endemic, at a large scale, when there's a threat, there is very quickly we can come up with vaccine tests and treatments. Bacterial groups also to be added to this list of potential pathogens. So WHO considered the evidence on over 25 virus families and bacteria and added a disease X to the list as well. Now, disease X is included to indicate an unknown pathogen that could cause a serious international epidemic. The initial 2015 list of disease priorities needing urgent H&D attention comprised of Crimean Congo hemorrhagic fever, Ebola virus disease and Marburg, Lassa fever, MERS and SARS coronavirus diseases, Nipah virus, and Rift Valley fever. And the latest at present, the priority diseases in the list include, in addition to the previous list, COVID-19, Zika virus, and disease X. I'll touch upon the viruses in the list so that we have at least some idea and we are familiar with these important potential threats. Coronavirus, COVID-19, we know caused by SARS-CoV-2. And you are all pulmonologists here. I'm not going to dwell any further on this. This is what we are still familiar with. It is still fresh in our memory. Next, Crimean Congo hemorrhagic fever. It is a viral hemorrhagic fever, usually transmitted by ticks, can also be contacted through contact with viremic animal tissue during and immediately post-slaughter of animals. It has high case fatality ratio, 10 to 40%, and is endemic in all of Africa, the Balkans, and the Middle East. Ebola virus disease, formerly known as Ebola hemorrhagic fever, is a severe, often fatal illness affecting humans and other primates. It is transmitted to people from wild animals such as fruit bats, porcupines, and non-human primates, and then spreads in human population through direct contact with blood, secretions, organs, or other bodily fluids of infected people, and also contaminated surfaces and materials. The average case fatality rate of Ebola is anywhere from 25 to 90%, averaging about 50%. Next on the list is Lassa fever, which is an acute viral hemorrhagic illness caused by Lassa virus, a member of the arenavirus family. Humans usually become infected through exposure to food or household items contaminated with urine or feces of infected Mastomys rats. The disease is endemic in the rodent population in parts of West Africa. Person to person infections and lab transmission is documented. The overall case fatality rate is 1%, but in patients who are severely sick and hospitalized, the case fatality rate is as high as 15%. About 80% who are infected will have no symptoms, and 1 in 5 infections will result in severe disease affecting liver, kidney, and spleen. Next comes the MERS-CoV, which is a virus transmitted to humans from infected dromedary camels. It has been identified in several countries in Middle East, Africa, and South Asia. They can range from, the disease infection can range from showing no symptoms or mild respiratory symptoms to severe ARDS and death. Approximately 35% of patients with MERS-CoV have died. About 800 odd cases have been documented. And 35% may be an overestimate because the case fatality rate has currently been counted only amongst the lab confirmed cases. Next comes the Nipah virus infection, a zoonotic illness that has been transmitted to people from animals and can also be transmitted through contaminated food or directly from person to person. In infected people, it causes a range of illnesses from asymptomatic or subclinical infection to acute respiratory disease and fatal encephalitis. Case fatality rate of Nipah virus infection is estimated at 40 to 75%. During the first recognized outbreak in Malaysia, which also affected Singapore, most human infections resulted from direct contact with sick pigs or their contaminated tissues. In subsequent outbreaks in Bangladesh and India, consumption of fruits or food products such as raw date palm juice contaminated with urine or saliva from infected fruit bats was the most likely source of infection. Human-to-human transmission of Nipah virus has also been reported among family and caregivers of infected patients. We have had close contact or cases. I think everybody is aware of the Nipah virus outbreaks in Kerala and how well they were controlled. And I'm so proud to share that WHO especially features articles and information on how India tackled, how Kerala model of tackling Nipah virus was so exemplary. Next, the Rift Valley fever, which is transmitted by mosquitoes and blood-feeding flies. Excuse me. In humans, the disease ranges from mild fever-like illness to severe hemorrhagic fever that can be lethal. Livestock can be infected as well. And in humans, the infections have resulted from bite of infected mosquitoes or contact with blood or organs of infected animals. Occupational groups such as herders, farmers are at increased risk. No human-to-human transmission of Rift Valley fever has been documented. Finally, the Zika virus, primarily transmitted by the bite of an infected mosquito from the Aedes genus, mainly Aedes aegypti, in tropical and subtropical regions. Aedes mosquitoes usually bite during the day, during early morning and late evening or noon. This is the same mosquito that transmits dengue, chikungunya, and yellow fever. Zika virus is also transmitted from mother to fetus during pregnancy through sexual contact, transfusion of blood and blood products, and organ transplantation. WHO declared a public health emergency of international concern regarding microcephaly and other neurological disorders and Zika virus from February to November 2016. Thank you. Now we will hand over to our moderator for the day, Dr. Nitin Abhyankar.
Thank you. Wonderful talks by the youngsters, Tanushree and Keerat. And you've put the whole thing into some kind of a perspective for all of us. I mean, I think this is going to be a very, very interesting session. And I, I, I think I'll go the unusual way, and I'm going to ask, because these are the two audience questions, and I think they are relevant. Dr. Somnath Bhattacharya from West Bengal, Kolkata, is asking, what is the extent of damage expected due to disease X? And I'll start answering this, and then I'll hand it over to the stalwarts, Amita, uh, the Indore wale Dosi, and then eventually to Animesh. So what is the extent that is expected? And where I think Tanushree made that reference when we said we lost around 40 lakh people all over the world, said that was about 4 million, something of that sort with COVID. And we are expecting with the so-called disease X, maybe around 5 crores or 50 million. 5, maybe 10, maybe 15. I think that goes all over the, all over the place. So I think with that, Amita, let me invite you first. Always the last to arrive, but fantastic to have you. And what is your definition of the extent? I mean, how bad can this disease X be?
I think the disease X can be really disastrous. I mean, we've just seen COVID, and disease X can also be much, much worse. So, a disease like COVID absolutely put our life to standstill. So many deaths, I mean, lakhs and lakhs of deaths. We don't even know the real number. Our complete life came to a standstill. So when COVID could do this, when they talk about other viruses which are suspected to be much, much worse, I think it can really create a havoc. And we have to be extremely, extremely prepared for this, because I really, really feel that the kind of damage, whether it is physical, whether it's related to life, whether it is, related to money, income, professional, or emotional, it would be just disastrous. According to me, disease X is very, very scary, extremely scary.
I know. I mean, I'm going to hand this over to Dr. Ravi Dosi, which is the Indore wale doctor who became super duper famous during the COVID pandemic. And I don't know anybody else who have seen 1100 or 1200 patients in a day. So what do you think if you are now going to encounter a disease like this? I mean, is this real, imaginary, or otherwise?
Well, frankly speaking, sir, at times COVID also felt to be quite unreal, but we have all sailed through that saga. And I think this is disease X definitely is an indicator to be prepared in a much better way than we were with COVID. I'm glad to be part of CCI, which was a part of the early organization spreading awareness during that disease X, which turned out to be COVID. So I feel the important thing is that what we have learned from our first disease X, COVID, we should be more aware about that, so that hopefully the extent of damage would be less. But what is important is the disease X always tends to have an epidemiological pattern which is very unexpected, or it is so natural that it tends to spread very fast. So I think we need to be very careful. And definitely this is an amazing initiative by WHO, that it forewarns us that keep the basic precautions and keep preparedness, because once these sort of things come, it's not like कि one news item you hear कि यार कभी मर्ज हुआ सऊदी अरेबिया में, कभी वहां पे हांगकांग में कोई केस मिल गया, and you see people of ICU people doing things. But I think this is a good initiative by WHO, and it lets us be more prepared.
So I think now I'm over to Animesh, and I have ruled in another question apart from the two previous existing questions. Is this really imaginary? What is the extent of damage? And why this terminology X? So, why X? Why not something? Why not start with most dreaded disease or whatever? So why X?
So I'll first start with a disclaimer like CCI does, and I'll take an anticipatory bill. I at least speak on my behalf, not others. I am not an expert. Let me tell you that I think we all are not, but yeah, we are not expert. But I am not an expert in disease X.
We are
Only
accusing
thing
you
is,
of being an expert, so you can take an anticipatory
So-
bill. Doesn't matter.
right. So yeah. But whatever we have seen from experience of this pandemic and whatever we know theoretically, so it is said that WHO actually came out with this in 2018, and it's like, I mean, I would say that it's so ironical that even after WHO gave us this concept, still end of 2019 or more so as 2020 onwards, we saw this COVID pandemic, and you know how much extent of damage we had. And this is supposed to be, disease X is supposed to be predicted to be 20 times deadlier. And as you rightly put the figures for Indian population, if you say we relate more to crores rather than billion, so 5 se 10 crore, 5 crore, so like it is 5 crores and all is expected kind of a thing. And you said that by, is it real or imaginary? Going by what we have seen, sir, probably not imaginary, because in the recent past, we have seen many of these. Of course, nothing was to the extent of COVID-19, whether we talk about, H1N1 or, it was Zika or for that matter, it was, that SARS or this COVID, obviously. I think we have seen quite a few. I have been traveling during one or two of these, in fact, Zika and SARS, and I know how scared we were. And coming to why
Are we getting him? Or,
I think there is a snag in the connection.
there is a, yeah. Okay. So I'll in the while he's there, let me move on to Tanushree, where you defined all these things and we looked at all this. What is the basic idea of terminology called disease X? Is it just just some kind of a hype, or or is it something which will prepare the world for a disaster in a true sense, or is it just fear mongering? Tanushree, can you?
Yeah, so actually,
yeah.
why I put up the chronology in my presentation was that we are not the only one worrying about it. It's the whole world together that
Absolutely.
is thinking about this as a
Yeah.
postulation, as we used to do in our statistics, that we have a hypothesis and we work on it so
Correct.
that we can come to a conclusion, a solution. And in this scenario, it's an unknown basically. We have a postulated organism that has been there in the past. Similar ones were there in the past, and we have already seen in real life just recently, if you go back to our memory of last 2 years, that COVID was something that shook the whole world out. So it's a possibility, even if very distant, but it's a possibility. And to be prepared for such kind of a scenario will only help us fight it off better. As we said, this was very practical preparations of vaccines, and we carry out precautions. It is just that preparation will help us fight something in future. Spanish flu, COVID-19 have shook humanity to an extent that many people have lost their lives, countries have been demolished, economies were shattered, people lost their job. I've still meeting people who have lost their job and their family. So preparing for something, I don't think it's a bad thing. And if you have something that might be coming in the future, preparedness is always better. And rather than sitting back and relaxing, know that nothing will happen in the future. So disease X is a postulation, is a hypothesis that can happen to be true in the future. So I do agree with it, and I'm always been the kind of person to be prepared for the worst and expect something good out of it.
Great. You put it wonderful argument. So now I'm going to be playing the devil's advocate and ask Animesh if he's available. Said, come on. I mean, we had everything in place.
I'm sorry. I got logged out. Yeah, now I'm here.
So yeah, perfect. So I think Animesh, this is a dusra for you. So I mean, they call it the Shane Warne's dusra, or whoever Kumble's or whoever it is. So we said we need preparedness. We said WHO has already woken up to it. The list is already in place since 2014. 2018, we have declared a disease X as an important entity. And when actually in 2020 or end of 2019, we were hit by the so-called only realistic disease X, or something which goes closest to it, we had an extremely shabby response by everybody across the world. And a country like India comes up trumps within a matter of a few months, despite all the poor resources and this and that, so many adversities, and such a diverse country, and the reach out was so difficult. So, I mean, are humans responsible for all this? What is happening though? And as the curveball that I'm putting you across to you, these kind of initiatives, are they really effective in the true sense to really take care of a pandemic? Does the preparedness convert into an action in the given time frame? Because we were expecting, when we said this is X, we have to be ready with a vaccine in 100 days. Nobody was ready with a vaccine in 100 days. Everybody took at least 6 months minimum. And then there were so many questions asked about the vaccines, about were they really effective. There was a lot of huge amount of hesitancy about vaccines, and so much and so forth. So on one side we have the issue of not disclosing everything and creating panic. On the other side, not preparing enough the whole world for it. So how do you see the whole thing? I have asked you 17,000 questions, so I think you can start answering one by one.
Yes.
Yeah.
Yes, I'm trying to assimilate. I'm trying to assimilate.
Yeah.
I hope I'm audible.
Yeah, you're audible.
Yes. So basically, see, whatever said and done, sir. Yes, whatever said and done, let's also accept the fact that for a country like India, as diverse with so much of population and so much of, I would say, that socio-economic diversity and resource crunches, I think we did quite well. And I think we also had a good, response from public and leadership. Of course, there were pockets, there were lines to be, looked at, and then we should actually pat our backs. Having said this, why, or can we be prepared? And, I saw some chat question, and you were asking that, is it possible, and how can we be prepared, and things like that. So yes, vaccine, sir, but if you look at from the history point of view or historical perspective, we still came out with the vaccine very, very fast. I mean, we've not had any other disease where we had a vaccine so, quickly. So that was one of the responses that we did in case of COVID. And then again, when it came to administering the vaccine, if you see, for a population like ours, it was a huge challenge, but we managed. So what we have learned, these COVID and then we also had, so many things which we looked at. So I think that way we have learned huge lessons, and I think this will help us going forward. It's a big kind of a thing which we have achieved. Am I audible still? I hope I'm audible.
Yeah, you're audible. You're audible. Sometimes breaks a little, but otherwise mostly audible. Yes.
Okay, so yeah, actually, there's been a bad weather since evening, so with a lot of thunder, lightning, so probably that's affecting.
Yeah.
I'm so sorry. So basically, sir, I think going forward, this preparedness, and then see, now we are also confident that yes, we can have a response to this. We can involve public. We can also have something which comes up like this, and then we can actually develop a vaccine, develop response to it. So all that is there, and I think that it's learning and big, confidence.
Okay.
Yes, this may be a threat. This may be like we might page and wreak havoc, but I think that's what I would take home from. And I think it's possible because we can see from multiple angles, whether it was healthcare workers, whether it was the cooperation of public, whether it was response to, okay, we can debate that whether it was scientific to have lockdown or not, but retrospectively, all this can come in. But if you look at the the situation we were in, and you look at around the world, prepared. I do not know whether I've answered because I lost some questions.
Yeah. In the transit, no problem. I'm sorry I've loaded you with so many of them, but I think I'll go back to Keerat on this issue and ask her because she was talking about the potential microorganisms. So Keerat, this question is to you. What do you think is the next battlefield? Where are we expecting it? It is going to be Nipah because it's already there in India, so close to our problem territory. I mean, close to our homes, or is it going to be something else? Or is it going to be one of the antigenic drifts and shifts? Because I think we already have, coming across the so-called ideas of influenza, the antigenic shifts and drifts, but we have a vaccine there in place. So we realistically don't expect a massive flu pandemic to happen. So is it going to be Nipah or what other organism?
Thank you, sir, for the very interesting question. I think you just said that the flu season is coming and should we suspect a flu outbreak, but we have a vaccine. But the question is, what percentage of our population is getting the flu shots? I doubt, other than the healthcare professionals, whether the majority of our population is getting flu shots. I do not think so. We don't even have a flu shot protocol program for children, like say England does or Canada does. We don't have flu shots for children.
But most of the pediatricians are already doing it, and most of the pulmonologists luckily are doing it. So therefore the preparedness part of, I'm not really worried. The fact that getting from there to a national level vaccination program will be relatively easy, and a vaccine is already ready. But Nipah, we don't have a vaccine.
Nipah, we don't have a vaccine, but Nipah outbreak in Kerala came and went out. It was contained before COVID came about. COVID came, which was most unsuspected. COVID was something nobody imagined something like this could come from the coronavirus family. MERS, we would have thought, okay, MERS, corona, but nobody thought that something like COVID-19 would hit out of the blue. And what are the chances of getting another pandemic? Much more now because of the factors which are at play. Factors being more and more deforestation, more and more human-animal contact. And it is not just health professionals that who need to be mobilized. The animal husbandry system, the entire veterinarian system, because they are the people who could probably see, if they see people who are, say, in a dairy industry, they see that the livestock is unwell and the livestock handlers are not well. Say people at abattoirs, who will be the first to see that outbreak? It would be the people who are handling animals and livestock, the veterinary sciences people. So we need to actually have them in the loop as well. And we are only looking at these diseases. We are saying, oh, these are the 25 virus families. I really liked how Dr. Tanushree stressed that fungus also she spoke. That fungus is not featuring in the list as of now. But we could be looking at a fungal pathogen as well. We are talking about this blueprint list, which comprises of the virus families that I talked about. But there are so many other families which are in circulation in different kind of animals. Come to think of it, Nipah is related to bats, and so was COVID. Has there been any increased protocolization of the wet markets?
I seriously doubt that. Very frankly,
Do we have any better protocolization for butcheries, for abattoirs? It's not there. It's bound to happen again. So
as I was asking, that there is a lack of overall human preparedness, and there is a lack of overall human will. I'm not trying to blame a country or praise a country, but in general, humans have been, talk of vaccine hesitancy, talk of hesitancy about wearing a mask, talk of, resistance to wearing a mask or other social distancing, so many things at so many levels. And I'm going to go back to two of the people, who really fought it hard. Again, Ravi and Amita. in during the COVID pandemic. And what do you think? The whole where can we go from here as regards the so-called disease X? So we have the whole the story on a platform that yes, there is a possibility of an unknown virus hitting you again. Yes, people are telling us, the public health experts are telling us that we are not 100% prepared. Yes, organisms are going to jump from, like Keerat says, that it can jump from the wet markets, it can jump from the kind of preparedness that we have, butcheries and so on and so forth. So how do you, what is the move forward? I mean, how can we better ourselves? First, I'll go to the Ravi. Yeah, Amita, yes, come in. Yeah,
Okay,
wonderful.
so
You are the next, according to
yeah.
me. Yeah,
So I have a little different outlook to all this, So
yeah.
I'm basically extremely convinced that COVID was basically, accidentally released into the air. Okay, and basically the thing is that COVID actually happened because it was supposed to be stored and it leaked out. And that is the reason the entire problem happened. So honestly speaking, I'm not really very, very sure about this disease X, if we should be storing these kind of deadly viruses. I mean, what is the guarantee that they will not release once again? What is the guarantee that somebody might just get upset and may want to actually have bioterrorism and like really start a war and trouble people like we keep on seeing in all kinds of James Bond movies? I mean, how do we know that people will not really use these viruses and bacteria which are multi-resistant for their personal gains? So honestly speaking, this disease X to me honestly just sounds like this very big hoo-ha about nothing. They are trying to pretend, WHO as always, that we are trying to do so much for humanity, but we know when the need is, it always falls short. I'm not really much in favor of, storing such organisms, because the thing is that to make vaccine in 100 days is still huge. In 3 months, how many people will die? So what are we actually achieving out of this? And the thing is that you have to isolate the organism and confirm that it's matching with what you're already storing. So to isolate the organism, if you isolate the organism, then you might as well make a vaccine against it. So this 100 days limit is not sounding exciting at all to me. So I think this COVID X is nothing else than a hyped up nothing. It's like, playing a double blind game. When you're playing a rummy double blind, kuch मालूम ही नहीं है क्या चालू है. It's something like that only, I feel. I'm not at all
Ravi,
interested in this disease.
yeah, very interesting conspiracy theorist, Amita.
Yes, absolutely.
Mission Impossible,
Ebola, everything.
the
Yeah.
rogue nations. So I think
Yes,
okay.
yes.
So let's hear it from Ravi.
Well, sir, I look at it from a point of view of a great opportunity. Disease X and the amount of stress given also shows that how much preparedness we will be in. It helps us to prepare more for better diagnostics, more efficient therapeutics, and earlier identification in lower down the chain. How? Means you diagnose things early, you cannot make a specific test till the pathogen arrives. It is not only disease X, it is also pathogen X. So you can't have one diagnostic test, but at least we can work on those diagnostic tests which can identify, let's say, conditions causing SIDS or cytokine storms earlier. We can work on rapid diagnostic methods or protocols on a community basis, which is very difficult. As far as therapeutics is concerned, I am very much in agreement with madam, and like Keerat pointed out that remdesivir was supposed to be for something else and incidentally came up and landed up in COVID's lab. So there is a huge research and a paper in Lancet on disease X, which has been funded by the Bills and Linda Gates Foundation. And what Melinda Gates Foundation, what they say is, okay, it's difficult that we identify pathogen X, but at least let us have that much capacity to build an antibody to that pathogen X within a short time period. So even
and particularly when there is a antigenic change which has made it either very infective or very virulent, either of the two changes, and we have to identify those two changes, and therefore that 100 days windows. The whole idea of having it stored, that maybe partly answers Amita's question, is why should we have a bank? The bank is necessary. Well, I mean, some kind of a missile. I mean, there are so many in the air right now attacking each other. So you don't know whether it is going to hit one of the UK laboratories. And like what happened in Wuhan, we have a conspiracy theory saying that it got leaked out, and so on, so much and so forth. And then people
So,
accusing each other that it was a Chinese virus and it's a Chinese. I mean,
1 minute, let me
so yeah,
So just to be the devil's advocate,
yeah,
basically the thing is disease X was introduced in 2018, much before COVID happened. So
yeah,
I basically just feel that if we were prepared from before, okay, then whether it got escaped or it became or whatever happened, China never gave us the virus. We had to
yeah,
basically really work on it. So how
yeah.
did it really help? I mean, how did it help at all? So I basically really feel that, of course, it's good that we are thinking about it. But before COVID happened, disease X was labeled, it was existing, and there were promises to make a vaccine in 100 days. We all know how the vaccines were. I mean, we all just know about the Pfizer, etc., etc. So I don't know what preparedness are we really talking about. I mean, honestly speaking, it's different to talk big, but I think it's more important to be sensible. What have we achieved out of this disease X if we count about COVID? Were the vaccines really good? Were they produced in time? Were they effective at all? Didn't they create many more damages than actually they should ever have? So
So yeah, Amita, I take
I want to
today
just
to
say
yeah
obvious that it's good to talk big, but at the end of the day, we have to talk sense. So according to me, WHO is just trying to make news. Sometimes you just want to remain in news by saying things. I think disease X is just that. I'm not at all impressed about this disease X concept of having to store things so that you can create a vaccine quickly and you can have a defense mechanism, because we saw what happened in COVID. Disease X was present in 2018, much before COVID.
excellent. So I think we have a naysayer here. So I am going to stimulate Tanushree first in, and then Animesh again to counter what Amita has said. I don't want agreement here. Let there be a debate and fight.
No, sir. I like way ma'am has put out a counter argument. This makes the whole discussion very interesting, because otherwise it would have gone to a single direction. Yes, I have watched a lot of documentaries on COVID-19. A lot of theories are there that America was the one actually responsible for the
Yeah,
leakage.
I guess you
There are
have watched
huge
the
number
movie
of
Vaccine War,
theories.
a very interesting
Yeah,
movie called Vaccine War. I
yeah,
mean,
exactly.
yeah,
But
yeah.
from my
Again,
point
lot
of
of
view is,
conspiracy theories there.
yeah, what I feel is that just like Dr. Keerat said, a pandemic can be disastrous because the huge travel amount of travel that we have these days, the urban population getting congregated. The whole idea is, after COVID-19, do you really see changes being happening around in the healthcare sector? No. Number of oxygen plants opened up near us in the urban areas might be there, but what about the rest of the healthcare infrastructure? So it's just not about vaccine that we are talking about. It's just not about disease. X is an entity, which means that for future, learn from COVID-19 pandemic and implement certain things so that humanity doesn't suffer again because of the laxity. I don't agree with WHO at all. It's a very lax organization, but the concept of disease X is, for me and for others, should be that, again, let's be prepared for something like COVID in future. Don't be so lax. I see people around criticizing vaccines and not wearing masks. The one who's wearing, he's made to feel as if he's very scared. Obviously, wearing a mask only cannot prevent a pandemic, but let's learn from our mistakes and shortcomings during COVID, and be prepared for this something that, like disease X, that might be coming in future, so that the humanity that we lost, the amount of money that we lost, is saved, at least somewhat saved, and we are better prepared for some other pandemic in future.
So Animesh, now over to you.
So I am very interestingly listening to, very nicely listening to both, and I do agree with certain points raised by Dr. Amita, and I really appreciate Dr. Tanushree the way she's put up the points, put forth the points. Sir, I would just, before I say something, I would just like to, ask and remind people. Just before the COVID pandemic, tell me how many of us, even forget about the general public, how many of us, the health fraternity, were wearing masks very regularly? I mean, even if we
I think point extremely well taken. Extremely well taken.
Right?
So I think
yes,
yeah,
exactly. So the point I'm trying to say is, see, now our habits have changed. We have become more accepting to certain things. I'm talking about health professionals. Forget about the general public. So, and Dr. Tanushree said that, people wore masks, and so now you see, and some people laugh. Yes, but I see much more compliance with these things, much more compliance with hygienic habits. Hasn't that been the effect of this pandemic? So let's look at also the positive aspects.
No, so I would like to not agree, Dr. Animesh. The thing is that is nothing to do with disease X existing. I mean, not because WHO said there's going to be disease X that people are more careful. We always learn from our mistakes. If we don't, then we are fools. So the thing is that God has given us a slap on our face. We might as well open our eyes. So the thing is, just because I still don't wear a mask anyway. So the thing is that if people are wearing masks or being more hygienic, that's because we've learned from it. It has nothing to do with disease X. I mean, I'm not having this webinar. I kind of feel it's a very hypothetical, hyped up thing. मतलब like चूहे में से mountain बनाने का,
No. I think the idea, Amita, the idea is not hyping it up. The idea is rationalizing the whole concept to our best abilities.
Let's try to understand the basic philosophy behind disease X. And as we all know, disease X was already talked about, and this was already there on papers in 2018, as early as February 2018. Still, we had the pandemic. I said this already. However, having seen the pandemic and this disease X being there, now it's our responsibility that we take things more seriously and look into it, how we can make it better when it comes to next thing that we face. Yes. It's not that, again, I can go back 100 years back, we had this, that flu.
So actually, Animesh, can I come in just to add to what you're saying?
Sure, sir.
Actually lost 5 crore people in Spanish pandemic. And at that time, the world population was much smaller.
Absolutely.
Much smaller. And today we have lost only 40 lakh people.
Yes.
So 40 lakh people all over the world. India lost only 8 lakh people. So we were expecting 1 crore deaths by our very conservative estimate, and we still lost much lesser, because I'm not saying it was WHO had all the credit. I think a lot of people came together, but they came together because of the awareness, and the preparedness eventually came in. So I think, please go on. Sorry.
Exactly. That's, you made a very valid point. I would have come to that. So exactly, sir. And if you see the proportion of, the deaths or whatever, it's much lesser. As you said, the world population at that time and now. So see, there are two ways of looking at it. Sir, we do this webinar or not, we talk about disease X or not, if it had to come, it will come. But if we are, I always say that, wise is a man who learns from his mistake. There is a saying. But wiser is a man who learns from others' mistakes. So see, we have also seen what went wrong with other places and other countries. Of course, we made mistakes. So we can learn from these experiences, we can be better prepared. And it's not a hype. I would say that, now with changing scenario and with so many diseases that have happened in the last 10 years, if you look at, which we have actually encountered, I think we need to be focusing and, be mindful of these things, because then only we can be prepared. Coming to even, the scoring of it. Sir, we have eradicated hardly any disease, smallpox being the one and the, most importantly remembered one. We still have samples at 2 places, Atlanta and I think somewhere in Russia.
Even polio is on its way out, more or less.
It's exactly. But since the samples are preserved, and if you remember, I don't remember the specific, but a few years back, there was a threat. And, we don't usually now vaccinate against smallpox. But the American army was and those Marines were vaccinated against smallpox. Why? Because there was a threat. They at least felt that there is a threat of biological warfare using this or maybe So how did they make? Because those samples are there somewhere, and that's how they could use that and replicate and, things like that. So again, I'm trying to drive home the point that, see, there is of course, some rogue, this thing anything can be misused. Technology can be misused. We can talk about any technology. We can talk about AI. Rogues can be there. But what I'm trying to say is, yes, there is a point. We have to act responsibly. We have to learn from these things. And I think I'm a person who looks positively and optimistically. So I would still say that, yes, we have lost lives. We have had our challenges. I think we have had near dear ones lost or sometimes very bad condition. But still, looking back, I think we've done well. And I think we should take this in our stride to be better prepared for whatever it may be. Right now, it's called disease X. Disease X can be anything. And the whole thing is, whether it is Ebola or whether it is, some other thing, or that way, if you look at, this, the disease, that COVID we are talking about, SARS-CoV-2 was there. It got a little, mutated. And that's one of the things about this becoming a pandemic or a huge thing. So basically, viruses mutate much higher and faster than the bacteria. And that's why this threat looms large. So, I mean, that's what I would like to say.
So while we are on these organisms issue, and we have talked mainly about viruses. So, Keerat, this is a question to you. Are some rogue bacteria around? I know we are talking of drug-resistant organisms in the ICUs all the time, and and what do we foresee? Are we looking at our ICUs as a potential spreaders for the disease X bacteria, the drug-resistant ones?
Sir, I would like to add to the ongoing conversation also before
Please.
I comment on this.
Please.
I think the wisest try to be aware of what they don't know. So the fact that WHO has kept the placeholder name disease X shows that they are wise enough to acknowledge their own limitation and shortcoming of the available information on pathogens. The fact that we now have 2 new platforms for vaccine. We had the lipid nano particle platform, which was developed during COVID-19. The fact that we have the new adenovirus platform, the mRNA platforms we have now for making vaccines. This is the addition, and this is an achievement of the joint international effort in the run against time to come up with a new vaccine.
Exactly. I think can I come in for a second here and say, we travel in Konkan, and the Konkan areas are like, hilly and turning all the time. So it's a steep curve ahead, U-turn ahead. And then despite all that, people make some clash, the crashes in one way or the other. So that warning or preparedness or forewarning, those people who are forewarned are forearmed. That is the whole idea. So I think, please go ahead. Sorry.
So when Nipah also came to India, let me just quickly go through it. Nipah, 17th May, the first case in Kerala in 2018.
Yeah, that's a very interesting story of
Memorial Hospital. And by 19th, they were quick to identify Kerala state government, like Kozhikode people at Baby Memorial. They were very quick to notice that something is off, something needs to be identified. And they sent the samples to the regional lab. Had they not done that, had the regional lab not have the samples, so the genetic mapping of the DNA that we have, the RNA that we have, is so essential. How else do we identify what we are dealing with? And the fact that by 19th of May, from the central government side also, the director for communicable diseases, contagious disease control, they were in the state, and things got moving. Over the next 1 week, they had actually started surveillance of about 2,500 contacts of those 16 cases. And by the next month, so we are talking May, by mid-June, it had been contained. It took 1 month. And I would really like to hear from Dr. Animesh on the amount of effort that went into this containment. The fact that WHO talks about this, it is exemplary. And I really salute the state health model of Kerala.
Yeah. In fact, we had Pradeepa just now with us just before this meeting started, and I think Kerala has put some kind of eye anjan to all of us. They managed the first wave of COVID also brilliantly well. So Animesh, your thoughts on this, please. How did it come, and how should we adopt to this scenario? I mean, how can we copy Kerala in a better way?
You're muted.
Animesh, you are muted.
Yeah, thank you. Sorry.
Yeah.
So there are a few things in the background that we need to look into or understand before we go into that. So one, Kerala has a very good literacy rate. makes a difference.
Excellent.
Awareness
Very
is
good
very
point.
good. Very close and well-knit community, irrespective of the differences or the caste, creed, whatever the religion.
Both
Very
are
well
correct.
knit. We
That's
have seen it in multiple this thing, including when there was a crash in Calicut, that Air India Express plane, that Vande Bharat flight. But we've seen that. So all this helps. The other thing is they have a very good public healthcare system, especially the primary healthcare system. Why I'm saying is we have now started talking about it as a model. Now, when this happened, the first case that Dr. Keerat was talking about, and then this came to the government hospital. And then immediately they had suspicion, as she said, and in fact, it was sent to my university virology lab, that is Manipal Institute of Virology, which is mentioned even in places and movies. And then it was also simultaneously confirmed by National Institute of Virology at Pune.
Yeah.
At the same time, there was a high index of suspicion, and the physicians and others actually looked at that, and immediately the contact tracing was started. Now, it's not easy, but the mechanism they have in place and the grassroots level health workers, along with the community medicine department, played a big role. Instantly, my friend Dr. Asma Rahim, who's there, and her colleagues and PGs played a big role as well. So the whole mechanism got into place. At the same time, there was a political will. And this whole thing came up, and then they started this whole thing that people immediately had to respond, and then they had to comply. And so all this, if you see, it's a very concerted and coordinated effort. And that's how it was contained. So Dr. Keerat said, sir, 18 June, we declared that it's gone. Hardly a month. Of course, Nipah is a different disease. But if you look at it, the whole thing is about people's cooperation. Also looking at, and also looking at the mechanism where people will selflessly go and of course, we lost some healthcare workers as well. But what I'm trying to say is that the mechanism that where we had documentation, we could do contact tracing and quickly, and then see to it that all those people were quarantined. That also helped, and they complied. So we had this kind of a mechanism, and it really helped.
Excellent. I think that's something which is the food for thought for the day, actually. That preparedness at not just the level of consultants, the best in the best, but at the primary care level. And the reporting, which was very fast, the fact that those samples were collected, preserved, and transported in good time, and the best in the country could have a look at it. So I think the whole mechanism has to, from below up rather than from up down. So if you just say one person dictates and everybody else listens, that's not going to work. It has to be that feedback has to come from the grassroots and reach higher and higher and higher. And the best care facilities must be available at their disposal when they are needed. So I think that kind of a feedback loop, I think we have to encourage, not just encourage, but also, very frankly, I mean, we just got to trace, this is nothing to do with disease X, but we just got to trace gene expert positivity in one of our samples, which was not expected. So we immediately go on to the quality control, and the quality control has to come in place. And that kind of so the BAL sample, which is expecting something else, I get another hey. So we look at it carefully and don't suppress it, but look at it and look at the quality control and look at what can be done to mitigate that whole thing immediately. So,
one more thing I want to add. Sorry to. Sir, the government also rewarded those people in different ways. Some of them were given out-of-turn promotions. Some of them were recognized with, gold medals. And so those kind of things. See, it motivates people to work again if something happens.
If something happens,
a lot of these kind of. And sir, in the memory of, I forgot the name of that nurse who lost her life. So the Employees Association came up with that. Okay, best healthcare worker or something. Kind of, they instituted funds. And they contributed, and now this has been instituted that they will, nominate somebody, and then who works well, they will be having an award in her memory. So all these are things which, which are simple things, but they can motivate people to work, selflessly.
So the entire concept of preventive health is not just about experts being in place. It's all about infrastructure and reporting coming from ground upwards. as it is relevant. So I think while we were, I asked one question to Keerat and she did not answer the
Yes,
second part
yes.
of it. So
The
I'm going to
answer
ask it again.
was
So bacteria.
the bacteria. Yeah, sir. So
Yes.
basically, our ICUs, they are actually places where they are like petri dishes of MDR organisms, multi-drug
Yeah.
resistant organisms. There's no, and we are our reserve drugs, armamentarium. We are slowly and slowly losing them because of the rampant. Or by the time patients come to us, they've already received a carbapenem. Already, they are the reserve drugs are also out in the open now. So yes, antibiotic stewardship is very important. But the reason this will not maybe qualify, so we could say that there's a pandemic in may I say there's a pandemic in my ICU when there's an outbreak of say VRE, vancomycin-resistant enterococci.
Or
So, but it will
Acinetobacter.
still be
Or Acinetobacter, because
but it will still be limited to the ICU because the the transmissibility is low. So that is why
but at the same time, I mean, let's take this argument a little further and say almost most tertiary care centers have drug-resistant Klebsiellas, they have drug-resistant Pseudomonas, they have Acinetobacter coming and going in outbreaks, and they are drug-resistant Staphylococci. Though the gram positives are probably much shorter in numbers, but the gram negative rods are there everywhere in almost all ICUs. So in fact, very frankly, this is a question to all of us. How can we sort of, I would call it a disease X which is modified rather than the disease X which is going to kill people in a very short span of time. I think this has been already doing it for last 20 years, 30 years, and the last 5 years have been much worse. Because I don't have answer to some of my patients when it is pan-resistant, drug-resistant Klebsiella. And what do I do with it? And they're dying because of it. Just because they are entering the ICU.
So can I answer this?
Yeah, please.
Yeah, so I think it's just going back to the basics. So first of all, we have to be very, very judicious about our antibiotic usage. Just because an antibiotic is available does not mean we use it. That is number one. We need to understand and differentiate a commensal from a pathogen. Just because we isolate organisms from sputum or trachea doesn't mean we necessarily need to treat them. Also, we need to treat them for a particular amount of time. Okay, you're giving it for 5 days, 7 days, 10 days, 14 days, whatever. But then it just doesn't go on endlessly. And most importantly, you have to be wise in using. You don't need to cover every time with a broad spectrum. The minute you know which is a pathogen, you may, in a person who's turning septic, while you know what is going on, you may start with a big thing. But once you know what you're dealing with, please cut down the and rationalize. Step down, rationalize, use procalcitonin, which is specifically recommended now for stepping down your antibiotics, etc. We have BioFire, use BioFire so that you know which antibiotic to use, you know the results in like 45 minutes, you know what is to be used for you. So you make use of new technology. And I just feel it's very important to be responsible because it's difficult to come up with new antibiotics all the time. So more resistant organisms we have, more irresponsible is the use of antibiotics.
Absolutely.
And we need to understand this. Yeah.
Very well put, Amita. Dr. Ravi, your thoughts on this, and then I'll go to Tanushree again because she's been quiet for a while.
Sir, the several organisms, I was just pondering as you asked. We have had tuberculosis and HIV pandemics throughout. Now, at one point of time, HIV was a mystery to people, and then it erupted as a pandemic. And now we have come to a stage where even sexually transmitted HIV undetected don't transmit HIV anymore. That is how good antiretroviral therapy has become. So my point is, again, I somehow feel very positive with this disease X concept that having early preparedness and high research contributes more to its understanding, earlier development of mechanism. As far as organisms are there, ma'am, sir, it can be anything. Like TB is no easier a problem. HIV still exists, lot of immunosuppression, even candida at times. Just day before yesterday, I lost a patient to PCP. So things seem to be very, very simple, tend to get complicated, and they can assume disease X. Means they can already be disease A, B, C, D, we don't know. Why X? they are already
Yeah.
known to us.
Yeah. So the known unknown, the concept of known becoming suddenly dangerous. And of course, I mean, we are talking of an ICU environment which is 5 or 10 people, and we are talking of the world stage scenario where 5 to 10 crore deaths are expected. So these are two different dimensions, but every hospital is having at least 40-50 ICU beds in most of the tertiary care centers. So I think we are not talking of a small number of people who are needing these. And preventing unnecessarily people being into the hospital environments also may be one of the preventive measures. For example, somebody who can do manage on home oxygen or a home based care with an non-invasive ventilation also is fine, because he is likely to live longer than people who are one way or the other put into the ICUs for no reason.
Yes, of course, you're very right.
Definitely.
You're very right. If a person doesn't need ICU, you should not
Yeah.
put the patient in the ICU.
Yeah, just because he's a VIP or one way or the other. I mean,
Be
yeah.
responsible. That is the bottom line. Be
Be
responsible.
sensible, be responsible, be judicious. I think those multiple take homes in this point. Tanushree, you have been quiet, so please.
Yes, sir.
Yeah.
Yes, sir. Ask me anything, sir.
So what
No,
do
sir,
I ask you?
I had an observation to share, sir. I just
Yes,
had an
yes,
observation.
yes.
So the basic thing is the taboo associated with disease. Basically,
Yeah.
the COVID initially, people did not like to get tested. Ki, "Arey, he will come positive, they will come positive." Then once it became universal testing, the magnanimity of the problem came out. So,
Yeah.
having the concept like disease X, if you start training children from the nursery, if there is anything abnormal with your physiology, get yourself tested. So, like maybe
Tested. Very important.
PHC
Yeah.
strengthening works at a community level. I think training our children to awareness about disease might work at a more general level also.
I think I've been very well taken point, but at the same time, there is a counter to that also, because there is a potential of creating a panic in the minds of people to leading a life. So that brings us to the idea of ethics of pandemics. And Animesh was referring to that. So I think I'm going to invite Animesh. But before that, Tanushree, your concepts on ethics of pandemics, if you have any, and how should we be communicating news, in which manner should we go all out? Very frankly, let me confess that 4 days before the entire country went into a lockdown, I was invited into one of the big companies' research, I mean, scientist conference, and they asked me, what do we expect, because the COVID is around, and what will happen? Will we really think of a lockdown? And I said, "Look, we have to create thousands of lockdowns, but a nation will never go into a lockdown." And then, as Modi can surprise all of us, he did. And it was for the good of the nation. I'm not taking anything away from that. But very frankly, the ethics of pandemics is a very, very tortuous issue. I really don't say there is nothing like a perfect answer. They thought at that point in time shutting the nation down was essential. They did it. It was effective. It made a difference. So something about this, Tanushree, from your side.
So I'll say that they made a lockdown in the first phase. In the second deadlier wave, they did nothing like a sort of lockdown.
Yeah.
So basically, ethics means, first of all, in my first two slide, as I said, one was the cinema, the fiction, the
Yeah.
sensationalization of a particular disease. The second was again a sensationalization like media. So
Yeah.
even we were invited to by the top news channels, the Aaj Tak, everything, like me and my
Perfect.
all over the place. We were all over the place. So what
So
I
you're
feel
already a
was,
celebrity, huh? Okay, good.
before the pandemic started, the media was cashing in on this topic basically. I didn't
Yes.
feel that they were very, very responsible. Some of the questions were responsible and very filled with responsibility to make people aware, but
Yeah.
also some was to sensationalize. So from COVID, we can learn that there has to be some code of ethics, some protocol should be said. I don't know how much people are going to follow that, but
Yeah.
from COVID, we have learned that
And
the
we
whole
have this issue of freedom of expression, which comes up in
freedom
the
of
wrong time
expression, but
in everybody's
can
top.
be curbed.
Yeah.
But
Yeah.
yes, from COVID, we have learned that somewhere in some part of the world, everyone is going into a lockdown, somewhere it is not. And just for our country, we can say that try to formulate something that if something like this happens in future, what exactly people have to do, what exactly government might follow. The media cannot be controlled, obviously, but yes, uh, ethics are made, they might not be followed. What I feel is, as ma'am said, it could be hype also, and sensationalization also comes into play more or less often, and the whole gist is
No,
sometimes very small.
no, but imagine, Tanushree, imagine that if the country had just continued working like that, with no vaccine in sight, nothing in our hands, no preparedness, and if we had lost, say, for example, 1 crore people, that is what was expected. In fact, the early predictions for India were around 10 crore deaths. Then it started coming down and said 2 crore deaths. Even 2 crore deaths did not happen. We lost around 8 or 10 lakh people only. And so I think the first lockdown was very sensible. And in fact, the fact that they did not lock down despite the second wave, because by then we were already vaccinating people. I have had people in the second wave who were on ventilators because they had gone and taken a vaccine shot. But the immunity has not kicked in. So I think the second lockdown, and the Chinese went on into the lockdown zone 6 or 7 times, and they have lost more people than the India lost. Because the lockdown is not the only answer. The lockdown is not the only answer to the whole idea. So, Animesh, we are back to you again. With
Just a minute, Nitin, I'd like
sorry.
Yeah.
Amita, you're come
So
in.
in the second wave, honestly speaking, it was healthcare workers who were vaccinated and the elders who were vaccinated. The
Yeah.
younger people were not vaccinated
Not
and they
vaccinated.
died the most. So
Yeah.
we need to basically, I basically, like, I'm a Modi fan, but having said that, I just want to say that I really like the way Tanushree talks. Maybe we think similar. So basically, if we talk about ethics, we have to be common every time. So I just feel lockdown was very good. But the thing is that the lockdown has to be calculated, time has to be given to people. It wasn't that there were 20,000 deaths already and we had to go to lockdown in next 2 days. I mean, basically, the thing is that it was supposed to be entering India, but nothing had really happened. So, what was the need to suddenly lock down, not give people? Means, I remember people were admitted in Bombay hospital from out of town. We get a lot of people from out of town. They had no money to pay the bill. I mean, it was just so crazy. Suddenly, there was just a lockdown everywhere. So, I just feel that these workers, people were walking to go back home. I kind of feel it had to be better planned.
Ma'am,
And
what
also,
I feel is, I remember we were following the headlines, we were following the news channel. Airport was the port of entry of infection, like
yes,
almost
exactly.
months after it broke out in China.
Always, and nothing was done
Nothing
over there.
was
Nothing
done,
was
and
done over
no,
there. So
very few
it was
steps were
that
taken
big
over there,
fight
and
of
sudden lockdown for a whole country. That was very dramatic and
it
very
was
disastrous,
unnecessary. I think it was just dramatization. And I
yeah,
honestly
and
really
lack of
think the
planning
second time,
also.
no, also the second time the lockdown was not done because the first lockdown met with so much of criticism that there was no guts
Exactly,
to actually undergo the lockdown. So the thing is, I just feel that we as we as intelligent individuals should be actually accepting mistakes instead of just making like a blue thing and a green thing out of everything. So
Yeah,
I honestly
absolutely.
no, I honestly feel that lockdown was premature. And in the second wave, it was not done to prevent criticism. That was number one. I also feel that disease X is like just trying to cover up. When you spill something, you put a quick cloth over it to cover it up. So basically, just to avoid COVID discussion, to avoid any kind of blame for future, you want to say, "Oh yes, we are prepared, but what to do?" Means I kind of even feel that, come on, just grow up. Yeah, the thing is that you basically don't know what that organism is going to be. So what's the big point? You basically saving so many other organisms which may just leak out, and then you may just cause a pandemic which was never meant to be. So the thing is that you rather be sensible. You teach people things. You teach them right from school level. Children are the ones who are the best to be taught things. Right from 5 years of age, teach them what is discipline, what is health, what is hygiene, what is masking. You basically just make sure that every healthcare person is really taught well. You basically make sure that you have places which are to isolate people, and make sure those things still exist. You basically like you have to have a plan that when it happens, how will we immediately save our people, then try to isolate and then talk about doing a vaccine. I mean, according to me, it is just entire this disease X, according to me, is absolutely making a mountain out of a mole. According to me, it has absolutely nothing in it. I have no respect for it. I'm not impressed about it. And I don't even, I mean, what are we even talking about? What if they're done over here? Means, what is their plan? There's no plan. They are just saying, let's save all the organisms, let's preserve. And then in 100 days, we'll come up with the vaccine. I can
No,
talk
but
about
I think, but Amita, at the same time, we had a vaccine against flu over a few decades, and an effective vaccine is still every time getting generated, and we are vaccinating people on regular basis. So preventables are preventables. HIV, which was a absolute panic maker, is no more a panic maker.
Okay, so
Smallpox is gone, polio is gone, and we are still saying that we should not be prepared, or we should not be preparing ourselves.
Nitin, 1 minute. I want to rectify and I want to correct this. We are not already making vaccines against these organisms which we have saved.
We are in the preparedness because we are identifying these as potential dangers to the humanity.
So then make the vaccine and be ready, no? Why are we going to start making the vaccine?
No. So no, because that's see the no, 100 days is only when it becomes dangerous. So Amita, listen to me. The fact that it will become dangerous only when there are certain antigenic changes in that, and those antigenic changes need to be adopted into the new vaccine. So unless until we have a basic prototype ready, we will not be able to. This is not actionable intelligence unless until it's like saying, my first case, deadly case happens. How many cases will I wait till I start preparing a vaccine?
The flu vaccine was always available. The COVID vaccine has nothing to do with the flu vaccine. It's completely different. So, no, anyway, listen, it's a very personal thing. And I like to be honest. I mean, just because I'm attending a webinar does not mean I have to hype about
No, you don't have to agree. That's the beauty of it. Absolutely.
No, so I'm being very honest, I'm being very, very honest. And Nitin, I know you're really being you're being a great moderator. So you're making sure that the discussion goes on, So the thing is that you're making it very interesting for us, and thank you so much. But I basically just feel that this is my personal take. I personally don't think I'm impressed with disease X. But whatever. I mean, if people are impressed, then great. I mean, what is there to... WHO is not going to take away the term, so it's okay.
Okay, so Animesh, you can have the last laugh.
Yeah, no, that's fine. So, I mean, see, irrespective of whether we are impressed or not, I mean, just to say, I think when it hits us, we will probably realize. I think I would still say, let's not think about WHO or whatever. I think the key is that there could be something like this. And in the light of pandemic, I think we should be a little more prudent to think that if there is something like that, how can I better handle with the experiences that I've had? Whether it was positive, negative, whether we did mistakes, I think it's always that I would look at. I'm not a political person, or I'm not a fan of somebody, or not a fan of somebody else. But what I'm trying to say is, I think we all have to take home those points and learn. Coming back to the ethical challenges or ethics of pandemic, let me tell you, because again, because you told me about this, and you've asked me. Again, I'm very much keenly involved into ethics of multiple things, and I've also looked at some of these. So I feel, see, when we talk of ethics, of course, those some of the things that you said, but there are also certain core things. When I look at it from the academic perspective, or even from a professional perspective, see, we know some principles are there. But what happens is, when it comes to public health, forget about pandemic, I also look at public health ethics. So like, say, even if I look at polio vaccine, now there are pockets, or there are sometimes resistance. And we try to convince those people. That's why the concept of, when there is a home visit, and then if somebody is not convinced, they try to convince, there will be some superior coming and then talking to the people. So we don't again force, but we try to convince and give. The idea being that there is a herd immunity. And when it is a public health, they can always say that, it's my right. I have the autonomy. That's the thing we say. But why are we trying to convince those people to take the vaccine even when it comes to polio? Because we want to protect the entire community. That's the herd immunity principle. And again, it also has the principle of that, beneficence and non-maleficence coming in there. Why? Because if at all, I can probably be the reason for somebody else being harmed. I know, it may sound that very academic, but we have to look at these things as well. So when I come back to this pandemic thing, I would say that, yes, we have to look at these things, but sometimes that may be overridden. So that's why we saw that, there are certain things of freedoms which were taken away from people. There were certain curtailments which were happening, because when you look at the larger good, at the same time, it comes to the principle, there is another principle which is a utilitarian principle, where we say that we, for more people and things like that. Now, again, there, when we look at it, becomes very difficult and very tricky. There are sometimes, when you have to take very difficult decisions, you have very scarce resources. I don't have all the answers, but we have to think about and we have to see how we can improve this. We can probably think of criteria which is already in place. So how do we go about allocating these resources, if at all such a situation arises? If at all, we were faced, and then we can't keep one criteria. So as we progress, even if there is a pandemic or if there is an outbreak or something, we have to keep regularly reviewing them and revising those guidelines. So it's not that, it's a gospel rule, I did this and now it has to be throughout the 3 months or 6 months or 2 years of pandemic, we have to keep that. We have to, see to it, and we have to also evolve based on that. So those things will be there. And then probably, I would say that, yes, I agree with that it was too sudden a lockdown. I totally agree. Though there was a Janta curfew, if I remember, on 21st to 22nd of March.
There is a voluntary curfew,
voluntary thing.
1 day. Yes.
But 25th, that is 24th night when it was announced, was too sudden. And I think most of us were caught off guard. And Dr. Nitin, you said that, I was myself talking to Rotary Club, another Rotary Club a week before, and I was this in favor of, or I was not thinking of a lockdown. And in fact, 16th of February, I was traveling back from Calcutta after a Rotary India summit. And then at the airport, some people were wearing masks. One of my students met me and he was flying back. And I said, I don't think, and I was not wearing a mask. I was not taking it seriously, to be honest. And I come from epidemiology and preventive medicine. So I did not think that, but the way it suddenly took off. So I think most of us were taken, by surprise. We were caught off guard. We saw things and then we were lost also. We were not mentally prepared also. Let me also say that. Not
very frankly, I was the first one who got a proper COVID pneumonia in my hospital. And that was within the first, luckily it was in the first wave. So I did not get that big COVID pneumonia in the second wave with Delta. But at the same time, and my family got vaccinated as a trial of Covishield on August 1, when I was diagnosed. So August 1 was the time when I got vaccine. I got actually COVID, so I was immunized, and my family got a trial vaccine, which was totally not yet officially ready. And luckily they were also protected. But I think, just the idea that we were sensitized and we were prepared and we are ready to take these things on, we could conquer that. I was the only person who was actually allowed not to work and continued to work in my hospital, because they had exempted people above 55 to not to work, and I was 57 at that time. So it's still, and I still continued working. So I think, and Ravi is one of the shining examples of how much one person can take risk. So Ravi, please come in on this, and I have a few questions for all of you, one by one, so you can just answer them.
So I want to, just quickly sum up what I just started. So
please do that, seconds. And then I'll have the last question for everybody.
So when it comes to ethics, again, when it comes to public health ethics, pandemic ethics, it's no easy answers. But only thing is we should be primed, sensitized. And I would just like to say that, again, now, just about 3-4 days back, I read, I think second malaria vaccine has been authorized. That's a big, and again, Serum Institute is involved.
Yeah.
There's a vaccine trial going on already, and I met somebody.
It's been offered to us. It's been offered to us. We have not said yes.
Some sites. Exactly, but in some places. So we are not realizing there are many diseases for which the efforts are already on. We've not been successful. Malaria for so many years.
And dengue for that matter, very frankly. Dengue vaccine
is known to be an endemic area for malaria. If that comes, probably will be benefited. Of course, now we have lesser cases, but so these are some things we are not realizing. It's easy to say, but I think COVID has also been a catalyst to many other things. And I think we have to look at it from that perspective. Yeah. So I think that's what I would like to say. And as I said, I think we have to look at it positively and optimistically, learning from the mistakes. Okay. Thank you.
So I'm going to put the last question of the day for everybody. So there is genuinely a disease X that hits us. It happens 5 days from now. We are, as yet, as I can see, we are completely unprepared. So I have a few questions. Please try and answer them honestly. One, would you be considering a lockdown again or not? Second, would you be considering an early vaccine or not? Third, would you be looking at the available viruses as important source which is being stored or not, or I will try and invent it from the samples from the patients only, and not from the resources which are already readily available? Because somebody comes up and say, okay, fine, we already have this prototype, all we have to do is modify these two antigens and the antibodies against them, and then that's on. So we have a vaccine much earlier, or we will wait for enough samples. So that is the third or fourth. The fourth is a more critical part of it is, how am I going to communicate this to my patients, to the press, to the public, and what kind of communication should go across? Once again, that may bring us to the ethics of pandemics and whatnot. So I think that's going to be important. So how we communicate. So we'll start with Amita, the naysayer. Then
No, see, I'm not a naysayer. I just kind of felt that ठीक है बनाया है ठीक है इतना कुछ impressive नहीं है but है. Anyway, so the thing is that if the pandemic was going to come after 5 days and if it was going to be really so bad, so I kind of feel that if I was the government in power, I would basically urgently make provisions in which I provide people facility to use their money, to be indoors, get food, to be able to make some money somehow, or I would provide some kind of money. I would make sure they have food, water to drink, and they are comfortable. I would make sure I have PPEs, I have N95 masks. I make sure I have isolation rooms, isolation, centers, ICU beds available. So I will basically put all my energy in that, number one. Okay, then I will use maximum in making sure that we educate people in a very, very responsible way. So no nonsensical journalism. Only what we allow should be going across the TVs, across the website.
And who decides that? I mean, how do you as a doctor, you are not in charge of that.
I basically also said if I was in charge, if I was in the government.
Okay.
So the thing is that, yes, I was kind of making myself much bigger. So I mean that if I have to kind of manage it, I would basically make sure that I do it for everything. According to me, making sure restrictive movement is important, but it should not be at the cost of people's livelihood, people's food, etc. And I kind of would first see how bad the disease is. I would even like to see if any of the medicines are working before I jump into the vaccines, because I have definitely found that, I mean, at least I don't know if y'all are seeing it, but in Bombay, I mean, how often we have 35 to 40-year-old fit people who've undergone like CT coronary angios 2 months back, which reports are normal, who are just dropping dead. So the thing is that the vaccines did the job then, but I really don't know if the disease otherwise also would have become little milder over time. I really don't know. And at the same time, I don't think that if you have a similar virus, it's not that easy to create a vaccine for the new one.
Okay, so I think we'll move on to Ravi ji. Indore wale आइए sir.
Sir, my straightforward thing is if a potential disease a pandemic is on the verge of happening, I would promote the idea of having containment zones, and I would also promote the area that the government supports the family of the person who is suffering from that particular disease, so that there is no taboo. Rather, there is a positivity ki theek hai, ho gaya, but at least the government is standing with me and my family. So I'm not afraid of disclosing whatever I have gone through very clearly.
Okay, that's good. Any other inputs on this? Any other takes
also, I would just
about
vaccine? About this taboo. This is according to me. I don't think there was a taboo. I basically feel it was very, very scary that if you're positive, then for 2 weeks you had to be indoors. That thappa used to just come. So basically that was more of, there was no taboo in the mind of people, but the problem was about not being able to go out to do normal day-to-day activity. Initially nobody from the house was allowed to go out. I don't know if you are aware of it.
Yes.
So the thing is that if I got COVID, nobody from my family is allowed to come out. So it causes too much
they are sealed buildings in Mumbai.
Yeah, how you go and buy food. So according to me, there was never a problem of taboo. People did not want to get checked because they did not want to undergo inconvenience.
Absolutely.
So, sir, basically, from my point of view, I would have formulated a task force, basically. A task force which is allotted different functions at a time.
We are asking you, what would you do in future?
Yeah, if there had been an
So
pandemic,
5 days from now, we have the disease X hitting us.
So there's where our webinar concept comes in, that from last pandemic, COVID, then the disease X, coming 5 days from now, there should be a task force which is implementing different steps at different levels. Like ma'am said, some part of it taking care of the people's livelihood, the fund allocation. One part, like headed by Dr. Animesh, looking after the containment of the infection. The other part taking care about the treatment, vaccines, developing that simultaneously. Like developing serum institute, I will empower such kind of institute beforehand. That is the purpose of this webinar, basically, that these institutions should have been empowered beforehand, not now from 5 days. That cannot be done in 5 days now. So basically, one end working on the treatment vaccination part, one containment, one socio-economic aspect, and the other like learning the learned mistakes, what exactly are a team that would have this task force is basically focusing on the pandemics. That is what is WHO trying to do in a minimum.
One counter argument, a small tiny one to the whole thing, is most of the vaccine making or industry is already collecting intel on what is likely to be needed, and they are in sort of preparedness. They are in tandem with WHO one way or the other. We have been bashing WHO.
They are already,
we
sir.
know
They
that.
are already, yeah.
But they are already doing all this, and they are in touch with Porton Hawk or whatever that place. What
Porton
is that
down
shire?
in Wiltshire.
Yeah, Wiltshire. Yeah. So I think that one way or the other, people are in touch with each other. One way or the other, this, whether we like it or not, people are creating potential vaccine candidates and experimenting on it. And phase 1 trials are already on for so many others.
Like I said in my presentation, they are sequencing. They are going to minus it and add new sequences to make the new pandemic being serviceable.
Absolutely. Yeah. So I think, from the point of view of preparedness, I am not able to throw this idea of disease X completely out of the window and say this was nonsense. It didn't work 100% with COVID pandemic. I agreed with that. But I think we had an impact. We had an early vaccine. India
let's work on it more. So
let's work on it more, rather than saying that, well, I'm totally unimpressed and I just don't want to look at it again.
Okay, Nitin, just to say that it didn't work out. Just a minute, Keerat, 1 minute. With COVID, didn't work 100% means what? You think it worked at all with COVID?
It did work. The vaccination worked. I think vaccination worked for this nation.
I mean, the world. No, I'm not saying that vaccination worked or didn't work. I'm talking about the disease X concept.
The disease X concept and WHO were not the best, most popular. In fact, there are more popular concepts like the success story of India in general. Absolutely. But the success story of India was not only about lockdowns, not only about, it was about multiple things that were done. And those multiple things put together, I think we should not just throw the concept of disease X out of the window, but take it with a pinch of salt and say, okay, fine. We need to create some kind of a repository. We have to be much more careful in hiding it. I don't want to declare it कि ये wheelchair में बैठा है, इधर जाके एक weapon मारो तो सब जगह फैल जाएगा. No, I don't want to do that. But on the other hand, I want it to be there. Because if I don't have a resource, then I'm starting from the scratch, and then the first sample which reaches NIV, it takes much longer. The loops are longer, no question about it. The vaccine making industry, it is an industry at the end of the day. So they have to produce it on a mass scale. They have to have a correct antigen, and if I don't have that resource, if I have not listed it at all, I have not thought about it, how will I be realistically rapid in the response time? This time it took 6 months, because I'll tell you, it hit us somewhere in March, and my family was actually unofficially vaccinated on August 1. And I got officially vaccinated because I had a disease. So that was a different thing. But the unofficial vaccine was available within a 3 months period in India itself. So 100 days, 100 days was enough for us. And Covishield was unofficially available. Entire, I'm sorry, there are a part of Pune, which is near Serum Institute, was practically vaccinated. So, I mean, different stories. I think we may have to edit this out of the webinar finally. So please take it out, Krishna bhai. Please take these few
Sir,
sentences from my.
one point I would like to make is now
Yes, please.
AI is coming up in a big way. So I
Yes.
think AI has a huge role to play in these particular, because
Excellent.
it can actually screen very objectively, rather,
Yeah.
and it's corruption free. It won't allow
Corruption-free.
mistakes to happen.
Absolutely. I think it's a great point that you have made, that AI is going to be the one which will decide which candidate, how fast and how quickly it will work. And the trials and errors and simulated designs will be faster. So Keerat, I come back to Animesh. I'm going to come back to you at last. So you will have the last whatever minutes you want, please.
Sir, I feel 2-3 points. First,
yes,
if WHO had not talked about disease X, we would not be talking about it today.
Absolutely.
And the fact that we are talking about it today after COVID is done and dusted, more or less, I understand that variants keep coming now and then. The fact that we're still talking about this and the potential pandemic is because there is a placeholder by the name of disease X. The fact that
Absolutely.
WHO wants people to be aware. Second, sir, I want to come in about ethics of pandemic. The
Sure.
fact that there was a bird flu in 2018, H9N7, and China did not hand over the samples for analysis to the other countries. So this is where ethics come in. The fact that ma'am pointed out, Dr. Amita, that the lockdown was way too early. It caused people a lot of problem, and lives were lost. Migrant laborers, we saw, the nation saw very sad stories. I totally agree with her. The fact that we should have even a criteria when a lockdown should be instituted and when it has to be lifted. The fact that ma'am said that during the second wave, a lockdown was more important, had more value, but was not put in for whatever reasons. That is where the idea of having a body like WHO talk at an international level, because that's the only way to be coercive. The fact that we are having global warming and we are going to see mass migration with the climate changes, and this is also going to invite more disease outbreaks and pandemics. So all this makes the likelihood of another pandemic more relevant.
Absolutely.
And when you asked your question, sir, that how if we were going to have an outbreak in the next 5 days, we should all look at the Kerala model.
Excellent. And in fact, I would have loved to have Pradeepa or one of the Kerala guys to be on this panel. Somehow I think we have missed it, so we'll see how we can compensate for that. But I think it's a great example of infrastructure working, and that infrastructure needs to be made uniformly across the country. That infrastructure.
And not just that, we are also.
Sorry. Okay, yeah, go ahead, Keerat.
Also, we are only as strong as our weakest link.
Yeah.
The first case went to Baby Memorial Hospital, Kozhikode, had an excellent infrastructure, good ICUs, had the capacity to build an isolation in the ICU. What if the patient had gone to some local center? What if the patient had gone to some, I would not say private sector, small nursing home, or a very poorly done government sector hospital? What would have been the
and we are so diverse and so layered, basically as a country, as a healthcare
how to react. Like we have ACLS, advanced cardiac life support training. We have BLS, basic life support training. Similarly, we need to have a training on how to detect diseases which are contagious. It may not be disease X, it may be any other disease out of the list, but how to early identify, and how to go about. Out of all of us, 6 people here, right? I will not talk about Dr. Animesh because he already knows what's where. If I get a contagious patient, I will actually have to talk to the hospital administration. Who do I notify? I'll have to talk to my microbiologist. Where will you send the sample? Do we have these things ready?
We are blessed with NIV in Pune, so that is a different story. But I think everybody is not, and everybody does not have access
so
directly.
We send CCI Chandigarh, right? Whatever. But that's not the point. To have a system in place and to make sure we are aware at the most peripheral level. That is the requirement.
Yeah. So I think, the whole idea of how the tuberculosis program is at this point in time working out, the notification concept is increasingly coming, the public-private partnership is growing. There is a system in place which is getting a little better. There are a lot of nonsenses. As Dr. Udwadi had once published a paper, there were 158 regimens for a primary tuberculosis and this country. So, we were mad, but I think we are getting better. And let us continue getting better on this. Improving infrastructure, improving awareness, improving education, and so on and so forth. So, Animesh, before I hand it over to you, let me congratulate 935 people who are right now logged in as per Krishna Bhai's estimate. So, big hand to all of them. Thank you for being with us for this really out of the box kind of a thing, which nobody even knows, because Tridip has been asking a lot of questions. So he made a comment, is it disease X or syndrome X? So, so I think, the disease X is not necessarily everybody's ball game. And now he's excited about it. So he has asked a lot of questions. Most of his questions have been already answered. One last question before I go to this. I think there are some fear mongers among the audience. They said, is it going to be a virus, bacteria, or is it going to be the nuclear radiation, which is because of the end of a war? I hope not the third world war. We really would hate to have that, or whatever it is. But I think, Animesh, over to you and your comments. And I think mostly we'll close the session until something compelling comes up.
Personally, I think it will be most likely a virus, but again, because of variety of reasons, because it has a tendency to mutate faster, it can infect more. It's not as susceptible to antibiotics. It won't be susceptible to antibiotics, and we have antivirals which are limited armamentarium. So all these things put together, and the potential to infect large number of people, and then the capacity to mutate again and again very quickly. So many things. So I think it will be virus, but I would be happy if I'm proven wrong. Anyway, coming back to this, sir, before I take on to and then that part of ethics large that you said about So let me tell you. See, we already had, I'm sure that some of you recollect, or all of you recollect, this Park's textbook of preventive and social medicine. That's that's the Bible for community medicine in India, or SPM or PSM, whatever you may call it.
Yeah.
This has a chapter, emerging and re-emerging infectious diseases. It's been there since I was a student, and now we teach. And I think I've seen at least 6, 7 editions or maybe more. But there also they talk about, and there were so many things which have been including, some of these existing infections. So in a way, we were always knowing that, some of them were emerging, some of them were re-emerging. Re-emerging are like, you talk about tuberculosis itself as re-emerging. Because of the HIV, tuberculosis took a big proportion and came back. So that, however, we were still not well prepared. Second thing, as a result of this, now the NMC has brought in, with all these so many things, they have brought in a pandemic module, which is a part of the course curriculum. And that's been running for 3 years now. Yes, still there may be things to be desired, but all these what we were talking about, like who to report, how to go about, investigating, these things were there isolatedly in community medicine, in microbiology, in, different places. What they've done is they've synthesized it into a module and said that first year this much, second year this much, third, who is going to take it, all that has been given. There are certain hours marked. Hoping that with this, as Dr. Keerat was saying, that, you said you have NIV or whatever, at least the basics are already there. People are sensitized even at MBBS level. Just to make a point that, now at least that has come in. Coming back to this, sir, if it were to happen within 5 days, I think having learned from our mistakes and having gone through what we have gone through during the pandemic, we are wiser, we will do better. But a few things will play an important part, and I think we must not forget that other than the healthcare and other things, I feel that we need to look at how do we handle media plays a very, very important role when it comes to general public.
Extremely important. Extremely.
So
I'm not saying media gagging, but there must be a code of conduct which must be followed very responsibly by the media.
Exactly. And so media ethics. It's a very important thing. Actually, it's there in some of the even Southeast Asian nations. And I think we have to start thinking of that, because even forget about pandemic, even sometimes certain things which, the way media reports and that hypes up, and the public's response, whether it is aggressiveness or the other way, is based on that media. And I'll tell you, sir, after about 2 months or 1.5, 2 months, I stopped watching news because there was so much of, sensationalization. I was switching channels and I got fed up. So I stopped watching news totally. I stopped watching.
I stopped watching news 7 years ago. I stopped reading newspaper 8 years ago. So that's a different story. I only listen to what I want to
do.
I only follow subscription-based media. I've also stopped all national media.
So what I'm saying is, see, we need to educate even the media houses so that
and I don't want this to be censored. In fact, I want this to go out to everybody, that a very responsible person like me does not read newspaper, does not watch any news channels ever. I don't put on the TV in a hotel room ever at all, ever.
Sir, I'm very much like you in that respect.
Absolutely.
I will stay for 4 days, 5 days and come
back without ever putting the television on.
Yes,
I don't
that
want
happens with me. But I do read newspapers. I still read newspaper, of course, selective, whatever.
Very, very selective. If I have to read, I would rather read what I want to read, listen what I want to listen. And I don't want to be in an echo chamber. I want to be educated. I'm not unopen to the new idea. But I think this is very important part of this discussion, that responsible media reporting should be cultivated in this country. At this point in time, whatever goes on is breaking news. एक आदमी ने इसको थप्पड़ मारा, वो ठाक 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 10 बार दिखाते हैं. There is no end to that loop, and that doesn't work. That just doesn't work.
So I think
please go on. Sorry, I was a little emotional.
I think that's all, sir. I think so. Having said that, I think we have to look at it. As I said, we will have to look at multiple aspects and things, and very importantly, we have to engage the public. Though it happened somewhat in COVID, but I think we need a better engagement.
We need a better engagement.
Yes, I think our leadership did well, but there is a lot of improvement required, and then there were some goof ups as well. And so I think we need to accept that, and because I think that is very important, and I think our public will be engaging if it is done in a proper way.
Yeah, as I see it, no one was perfect in COVID pandemic, but people with good intent somehow conquered it. People with no intent or no direction, in fact, well-developed countries like Italy suffered. There were reportage, and for 4 weeks, they had simply said people above 65 need not come to the hospital. You may die at home. And it was as bad as that, because Italy was burning at one point in time with the first wave itself, and even before Delta wave. So I think this was the situation with first wave. So I'm sorry to say that I keep on saying that India did better, not to give credit to one person or other or something of that sort. Not a political statement. It's a statement as a united country, as a united effort, multiple people putting all their heart, blood, soul, everything. The healthcare workers, the police people, everybody who worked round the clock, took risk. So many of us got infected, so many of us conquered it. But I think that kind of an approach of a collective effort with a political will backing you and a sensible media reporting, I think that is something which has been missing in this whole thing. Because we have got on top of all this despite not so sensible media reporting. Even today, the disease X came under this kind of a purview, a discussion, because there is a sensational activity going on in the media. And that's why we are discussing this topic today. If you really ask me, why are we discussing it today? It's not an immediate threat 5 days down the line. We are not expecting that. But there is a sensational amount of reporting going on in the media for the last few weeks. I wouldn't know why that is happening. It's not necessary that you have to do. I would rather say a very sedate Rajya Sabha kind of, whatever those very sedate channels. I forget which those channels are. DD News once upon a time used to be like that, where a poker faced person comes and says things like, in a way, that kind of communication is better than the so-called breaking news kind of scenarios.
I think we can close now, sir.
Yeah, I think if you have any last laughs, anybody who wants to have the last ace, please welcome. Please.
I hope that once this is uploaded on the YouTube channel, we would be remembered as not the faces of Disease X, but the faces who actually fought against Disease X.
Absolutely. I hope that happens. I really hope that happens. Very well said, Ravi. Very well said, Ravi.
Well said, yeah. Nitin, I would like to congratulate you. Fantastic job, I basically feel there was such little to discuss on this, because there are just 2 lines about it, but you made it just so interesting and so interactive. And it was great fun, Nitin. As always, you rocked it. Awesome moderation.
Thank you so much.
Thank you to each of my panelists.
Thank you. And with that, I think anybody else to say? Yeah.
I think we learned so much that we did not know existed. And we are really more wiser and definitely a tad more prepared.
Yeah.
Deal with any eventuality, I think.
Okay.
So certainly this has been an eye-opener, and thank you for wonderful moderation and every insight, even ethics of how to behave in the pandemic. I think it's very central to good management.
Very true, sir. Now 9:35 logins and the 6 panelists.
And we are nearly touching 10 o'clock. I thought 9:30 we will be out of the place.
Yeah.
We are not yet out.
So it's a good take-home message tonight, and a very important discussion, and a huge amount of interest in this also. Thank you so much for the moderation.
Thanks everyone for being with us. And with that, I think it's a goodbye from me and my entire team of the panelists who have done a brilliant job. Thank you, and hope to see you again in the next webinar. Thank you. Bye-bye.
Good night.
Good night.